Hi, I'm Alex Gonzalez.
And I'm Nate Webb, and we are both community health navigators here at Santa Maria Community Services Wellness, and we're both AmeriCorps members.
One of Santa Maria's goals is to help families achieve their vision for wellness, and to do that we have a lot of different programs. Every Tuesday and Wednesday we have client hours where people can come in for assistance with financial aid forms, if they need letters of income for clinics. We have eye vision screenings for children ages 3 to 5, and we're working on getting certified for adult screenings.
We also put on 2 health fairs each year where we provide health screenings for residents of the Price Hill community. We just wrapped up our spring health fair, which took place on April 9th, and we'll have our women's health fair, which will be sometime in mid to late October. And then another service, what we do on a day-to-day basis, is working with a client list, calling them, following up with them, meeting with them in person, and making sure that they can meet their health goals, and doing what we can to remove any barriers they might be facing.
Here at Santa Maria, we take a very holistic view to health, so I work with my clients more as a resource. They come in looking for emergency prescription help, eyeglasses, eye exams that aren't covered through their insurance, help signing up for Medicaid, Medicare. I work mostly with the senior population. We go over to the Price Hill Rec Center every second Tuesday or Thursday of the month, and we have a registered nurse who comes out and she takes people's blood pressure, and I work with them on their health goals, make sure they're taking their meds, eating right, all of that kind of stuff. We also, one of our most popular services is we have a free psychologist who comes in and is able to offer free mental health counseling to any of our clients.
So what I do as a health navigator here at Santa Maria is I actually work specifically with the Latino population here in Price Hill. Vast majority of my clients are from the East and Lower Price Hill areas, and actually about 80 to 90% of them are from, they're immigrants from Guatemala specifically, and then a couple other countries mixed in from Central America. And so the services that we provide is we help enroll them in clinics, help them receive financial aid at hospitals. Due to their documentation status and the fact that the vast majority of them are uninsured, they're not able to do those things normally without some assistance, because there's barriers in terms of the language, the knowledge of the system, and how different processes work here in the United States. So we provide these services and that education for our clients. Another thing we do is, because Santa Maria has become sort of a trusted place for that community, and is that we get a lot of walk-ins who just want help with other random things. So we've started providing services such as helping with passports, helping enroll in schools, really just whatever our clients may need, on top of the health navigation aspect as well.
And since we are part of Santa Maria, we often direct our clients to other resources like our housing program, our GED, tenant education, financial opportunities to help them better manage budgets, because if they're busy worrying about rent or education or anything else, then health definitely falls lower on their to-do list. And as Nate mentioned, we also have our 2 health fairs. We have one in the fall, the Women's Health Fair, and we partner with other community organizations to bring in providers for mammograms and dental, cholesterol, glucose, all of the kind of basic health screenings that people might not get if they don't have a regular medical home or health insurance. And in the spring we kind of do the same thing, except it's more family centered, so there are also kids activities where we try and teach them health basics. And the special thing about our health fairs is participants register and they get a wristband and So we can kind of keep track of whether they need a referral for maybe they had a high level of cholesterol or very high blood pressure. So then about a week or two after the fair, we follow up with them and see if they've been able to get to a doctor and follow up with that result. And if they haven't, then we work with them to find a medical home or get health insurance or remove whatever barrier is in their way.